The fourth Sozosei Summit to Decriminalize Mental Illness took place on April 16th through 17th, 2024, at the Pennsylvania Academy of the Fine Arts, PAFA, in Philadelphia, Pennsylvania. This venue, with its historical significance as the nation's first art museum and art school, reflects the summit's focus on creativity and innovative approaches to end the criminalization of mental illness. The summit was at capacity with attendees from various backgrounds, including medical professionals, legal experts, activists, and those with lived experiences of mental illness, to discuss and advocate for the decriminalization of mental illness. The event was organized by the Sozosei Foundation, whose core values are creativity, curiosity, and collaboration. The first day began with a welcome lunch, with opening remarks delivered by Tariq Rabah, President and CEO of Otska North America Pharmaceutical Business and board member of the Sozosei Foundation. William H. Carson, M.D., Chair of the Board of the Foundation, and Melissa M. Beck, Executive Director of the Foundation. Antonia Hilton, author of Madness, Race and Insanity in a Jim Crow Asylum, delivered the summit opening keynote on the historical and systemic roots of racial segregation in mental health institutions. She specifically focused on the story of Crownsville Hospital, a segregated facility established in 1910 that revealed how forced labor and the vestiges of slavery shaped early mental institutions, creating a harmful legacy that continues to affect the mental health system today. In conversation with Kate Woodsum, journalist and founder of Invisible Threads, Hilton explained how an influx of mental health workers centering care and love in Crownsville shaped a new path forward for patients. Hilton highlighted the need to address these historical injustices to create a more equitable mental health care system, which provided summit attendees a powerful lens to engage with throughout the event. Summit participants continued thinking about how to provide access to mental health care during a keynote speech delivered by Dr. Jonathan Sharon, Chief Medical Officer of Healthy Brains Global Initiative. He challenged the current system's focus on punitive measures rather than community-based care, emphasizing that payment structures need to change to allow for a more compassionate approach to mental health treatment. He called for a broader policy priority that includes peer certification reimbursement through Medicaid and a stronger focus on housing. Dr. Sharon's message was clear. To decriminalize mental illness, the mental health system must shift its focus from institutionalization to community-centered care. The summit's first panel, moderated by Melissa M. Beck, Executive Director of the Sozosei Foundation, titled Sex, Drugs, and Mental Health, the Criminalization of Healthcare, invited participants to expand the decriminalization lens to pregnancy, drug use, and HIV status. Nathan Cisneros, from the Williams Institute HIV Criminalization Project at UCLA School of Law, Cassandra Frederick, from the Drug Policy Alliance, and Lourdes Rivera, President of Pregnancy Justice, discussed how the criminalization of healthcare disproportionately affects members of the BIPOC community, is infused with inaccurate information, and has a deeply negative impact on the well-being of thousands of people each year. The conversation underscored that the criminalization of healthcare anywhere is the criminalization of healthcare everywhere, and the need for a coordinated strategy to combat criminalization was essential. The next panel, moderated by Karis Merrick, Vice President of Partnerships at Inseparable, addressed the topic, Is there a right to direct one's own care?, focusing on psychiatric advanced directives, PADs. The discussion began with a definition, delivered by Dr. Marvin Swartz, of PADs, as a promising tool to enhance emergency and recovery care by enabling individuals to plan, consent to, or refuse treatments for mental illness in situations where they may not have decision-making capacity. The panel highlighted the challenges and opportunities in implementing PADS, emphasizing the need for greater education among healthcare providers as described by Claire Oduwo, a third-year psychiatry resident at the University of Washington. Marjorie T. Scher, an attorney at Epstein Becker, added background on the legal implications of PADS. Panelist Steve Michio, CEO of People USA, who shared his own experience with PADS, also pointed out that while PADS can help reduce trauma and allow patients to outline their treatment preferences, they are often underutilized due to a lack of awareness and barriers within the healthcare system. The final keynote of the day, Who is Paying for Our Care?, featured Lisa M. Gomez, Assistant Labor Secretary at the Employee Benefits Security Administration of the U.S. Department of Labor, in conversation with Dan Gorenstein, host of the podcast Trade-Offs. Assistant Secretary Gomez discussed the role of the Department of Labor in regulating private insurance plans and the importance of enforcing parity between mental health and other healthcare services. Gomez shared personal stories illustrating the consequences of a lack of parity and the ongoing efforts to rewrite regulations to ensure fair access to mental health care. She encouraged attendees to take action and contact the Department of Labor if their employer health benefits plan denies access to mental health and substance use disorder benefits. The first day concluded with dinner and a welcome toast by Karen Galley, board member of the Sozosei Foundation, recognizing the culinary arts and the importance of community as we strive for a world where mental illness is not a crime. The second day of the summit began with a crowdsourced recap of Day 1, centered on the importance of care, patience, and rest in the face of immediacy within the movement. Amongst a constellation of players in the work to decriminalize mental illness, the remarks reminded attendees to get to know one another, work deeply together, and turn their conversation into action. The first panel on Day 2 was the team from Gray, Athanasia Kelly-Efthymiou, Christine Gamble, and Gemma Slack, who showcased a creative campaign designed to reject the status quo of the criminalization of mental illness. The campaign plans to engage the public through film and imagery as storytelling mediums to illustrate the absurdity of the double standard between mental illness and other illnesses. A key tactic involves taking typical scenarios and substituting mental illness with other health conditions to prompt people to confront their biases. The goal of the campaign is to direct people to a microsite offering educational resources and a platform for advocacy. By challenging entrenched stigmas and reshaping public opinion, the campaign hopes to inspire a broader movement toward the decriminalization of mental illness, encouraging viewers to become advocates for change. The preview inspired feedback and effervescent discussion from the summit participants. The second panel discussion, What We Actually Know and What We Need to Know, Developing a National Research Framework to Decriminalize Mental Illness, featured Amy C. Watson, Leah G. Pope, and Michael T. Compton, and focused on the creation of a comprehensive research framework to guide efforts in decriminalizing mental illness. The panelists presented the research framework's approach and priorities, which aims to address various domains, such as individual-level interventions, community and system-level interventions, and policy-level interventions. The panelists highlighted that understanding the nature of the criminal legal system's involvement with people with serious mental illnesses is crucial to addressing these challenges, while also emphasizing the importance of peer-based crisis services and policy-level reforms to create meaningful change. The overarching goal, to develop a blueprint that researchers and funders can use to move the needle on decriminalization, was achieved. The day continued with action tracks, intentionally created space and time for participants to come together to discuss what they learned and brainstorm pathways forward. These sessions encouraged participants to work collaboratively on developing solutions to address the complex challenges in decriminalizing mental illness. Key takeaways from the summit include understanding the historical roots of the criminalization of mental illness is crucial to addressing current challenges. The legacy of racially segregated mental institutions and forced labor must be acknowledged and addressed to move forward. The summit highlighted the need for a stronger sense of community, care, and support within the mental health system, with an emphasis on the role of community members in providing compassionate care. The enforcement of the Mental Health Parity Act is critical to ensuring equal access to mental health services. Psychiatric Advanced Directives, or PADs, can be a valuable tool in reducing trauma and enhancing patient autonomy, but their implementation requires education and systemic change. Changing public perceptions is essential in decriminalizing mental illness and other stigmatized health issues, and is dependent on the constellation of stakeholders. Storytelling, collaboration, and research are needed to challenge biases and promote a unified narrative in the movement to decriminalize mental illness. Developing a national research framework to decriminalize mental illness is a priority, creating specific research questions and methodologies to address the various factors contributing to the criminalization of mental illness. The summit concluded with final remarks from Sozosei Foundation Executive Director Melissa Beck. She reminded summit attendees to engage in deep listening and community with one another, be present, and continue their learning journeys with each other beyond the summit time. The Sozosei Foundation Board Chair, William H. Carson, M.D., closed the summit by reflecting on how his father's specialization in mechanical drawing and architectural drafting endowed Dr. Carson with the ability to move space within his imagination. This skill is applicable in imagining how the Sozosei Foundation, an organization in its 4th year of existence, can continue to create dynamic opportunities for connection. Dr. Carson shared his father's words of wisdom: "You will never know unless you try."